I welcome you on my channel Step 1 Insights. Let's start. A 65-year-old woman is brought to the emergency department because of a 10-minute history of chest tightness and severe pain of her left arm. Physical examination shows jugular venous distention. Crackles are heard over the lung fields. An ECG shows ST segment elevation greater than 1 mm in leads V4 through V6 and Nu-Q waves. Serum studies show an increased troponin I concentration. Which of the following labeled points in the graph best represents the changes in cardiac function that occurred during the first 10 seconds after the onset of pain in this patient? The clinical picture described for the 65-year-old woman indicates she is likely experiencing an acute myocardial infarction, as suggested by the symptoms of chest tightness, pain in the left arm, jugular venous distension, pulmonary crackles, ST segment elevations in leads V4 through V6, Nu-Q waves, and increased troponin I levels. These clinical findings are consistent with left ventricular dysfunction due to ischemic injury to the myocardium. On the graph provided, the x-axis represents the end diastolic volume, EDV, and the y-axis represents the cardiac output. The points on the graph likely represent different states of cardiac function. W is the normal resting state. X represents a decreased cardiac output for a given EDV, which is characteristic of impaired myocardial contractility. Y could represent an increased cardiac output, which is not the case here. Z might represent an increase in EDV, which could be seen in compensatory mechanisms. During the first seconds of an acute myocardial infarction, the cardiac output decreases due to the loss of contractile function in the affected area of the myocardium, with a significant immediate change in the end diastolic volume. Therefore, the change from a state of normal function to decreased cardiac output with a change in EDV would be most accurately represented by the shift from point W to point Z. Thank you for watching this video. Subscribe my channel, click like, and never give up.